Okay. That looks like it's recording. And we're going to do a head-to-toe assessment today. And I've already taken my patient's vitals. Candy is sitting here. And her last vitals were 131/87. Temperature was 37. Oxygen was 99%. Her heart rate was 87. Respirations were 14. Are you in any pain right now? Okay, great. And you told me that you were 5'8", and I'm not going to disclose your weight due to patient request and patient privacy. All right. So, can you tell me a little bit about your health history?
Yes, I've had 2 C-sections, 2 vaginal births, and I've had surgery on my foot for bunions. And other than that, I don't have high cholesterol, typically not high blood pressure, and no history of it in my family. No diabetes. I did have a grandmother who had a stroke.
Okay.
There you go.
Any allergies?
No.
Okay. All right. So, I'm just going to look you over head to toe, literally. So, looking at your hair, it's even, it's a nice texture, and the same as your eyebrows. And how long have you had glasses? For
About 15 years.
Okay. All right. And do you mind to take your glasses off for a minute? Okay, I'm just going to feel around your eyes there. Okay, and those feel okay. And those are pink, scleras white, irises are green, pupils are brown. And I'm just going to shine a light in those, if you don't mind. All right, so just look straight ahead. Okay, and the I see perla, pupils are equal and reactive to light. And I'm just gonna look in your eyes.
Okay.
All right, so. All right, so the sharp edges are there. I don't see any abnormal retinal vessels, macula, yellow, red reflex. And this one, sorry. And the same with that one. So that's how it should be. And the optic lens and the disc looked fine. Didn't see any issues there. No tears or anything like that. I'm gonna keep trying to hit the wrong one. And let me just check my video here because I had some issues before. Looks like we're rolling. All right, so I'm just gonna feel around on your jaw here. Can you open and close your jaw? Okay, I don't feel any clicking, hear any popping, anything like that. Ears are symmetrical. I don't feel any lesions or bumps. Any problems with your eyes or ears? Okay, good. So I'm going to go ahead and take a peek in there. Okay. All right, just gonna look in there, and the tympanic membrane is pearly gray. I see the bony landmarks there. I'm just gonna come around here and look as well. And that side is the same. All right. I have this neat little device I can screw some different things on. All right. I'm sorry, I'm just putting some gloves on here because I'm going to inspect your mouth next. It's not been used, but look at there. Alright, so if you can just open your mouth for me. And I want you to say ah. Okay, the uvula looks good. I'm gonna check your gag reflex. Okay, that's great. And the buccal mucosa looks pink, and the tongue looks pink. And tell me about your teeth issues. Did you have any teeth issues?
Yes, I cracked a tooth not too long ago on the lower left down here and
Okay.
had to have cap.
I could see where you had that work done in there, but otherwise all your teeth were present. I didn't see any lesions or anything in there. And I'm gonna just look in your nose next. Any problems with your nose?
No.
Okay. All right, just have a couple of attachments here. I'm just gonna look up there, and the turbinates look normal, septum is in line, that's proper. Did you, you told me you had no issues, so I'm not gonna repeat my question. And just gonna palpate your sinuses if you wanna remove your eyelashes there. Okay, that feels good. I don't feel any lymph nodes anywhere. Alright, and the thyroid is not enlarged. Okay, good. You can put your glasses back on. What happened?
Maybe large.
Okay, so, have you had your thyroid checked or anything?
Yes.
And it was normal?
Yes.
Okay, so, I know that you have poor vision. We had actually tested that before. So I'm gonna test you with your glasses on, and I'm just gonna have you read the small sign.
LEFODPCT.
Okay, and then the next eye?
LEFODPCT.
Okay, all right, and that's good. Okay, so I'm gonna go ahead and use my stethoscope and listen to your back here. Deep breath in. Okay, lung sounds are clear, and your spine feels nice and straight, nothing's sticking out or abnormal. Listen to your carotid here. I don't hear any bruits. Okay, and I'm going to whisper something in your ear, and you just tell me what I said.
987
Okay.
654.
Okay, great. You have excellent hearing. And another test here. You tell me if you can hear that, and you just tell me when it stops.
Okay. Still going. Okay.
Okay. And I'm gonna just check the other side.
Okay.
And you can hear that?
Yes.
Okay, just tell me when it stops.
Okay. It's done.
Okay, great. And you don't seem to have any issues with that. So that's wonderful. All right. So I'm just going to go ahead and feel your pulses here. Those feel normal. They're not bounding. Okay. And then if you want to lay back on the bed for me. All right, I'm just gonna listen to your heart sounds here. Just gonna move your name tag a little bit. Okay, and also listen to lung sounds in the interior. Okay, and those are clear as well. And I've got my stethoscope. I'm just gonna continue down, listening to your vowel sounds. And your vowel sounds are normal. I'm also gonna listen over your bell artery, bell aorta. I don't hear any bruits. Renal arteries, no bruit. And down there, and your femoral. And none there either. Okay. Alright, so I'm just gonna come to the other side. Did you want me to cover your legs, dear? Are you okay like that?
Okay.
Okay. Alright, so I'm just gonna feel over here for, it's called your PMI, point of maximal impulse. Okay, and I can feel that. Alright, and I'm just going to be pushing on your stomach here. You feel any tenderness? Okay, and maybe some deep palpation here. And I don't feel that your liver is enlarged. Seems like the border is up here. I couldn't guess exactly, maybe 6 centimeters. And over here, your other organs, those feel fine. Those feel normal. And I'm just gonna check your pulses here, femoral arteries. And just moving on down. I don't see any edema on your legs. And you have good calf refill. Your nails look healthy. I know you mentioned the bunions.
Must have had one this one over here.
Yeah. But everything looks good. Your color looks great. Did you have issues with your lungs, coughing, anything like that?
No.
Heart issues, palpitations, or
No.
anything? And with your belly, any nausea, vomiting, diarrhea? No. Okay. All right, great. Now I'm just gonna have you go ahead and squeeze my hands. Okay, that's good. I'm just gonna have you raise your arms and out. Just make sure you have good range of motion there. Okay, that's good. That's great. Up and down, yeah. Okay, and your neck. Okay, I think you have good range of motion with your neck and your legs. I know that you have a dress. Okay, so maybe you can try to do it like that. Okay, just move your legs out.
Whoops, sorry.
That's okay. And I can see under the blanket there. These are moving those appropriately. Abduction, adduction. Yes, wonderful. Okay, that's good. Okay, we can do that. Okay, so I'll do your deep tendon reflexes here in just a moment. Did you have any muscular issues,
No.
concerns?
No.
Nothing like that.
Mm-mm.
Okay, good. Did you want to sit up for me?
I can.
Again?
Yep.
Because we're nearing the end. So I just want to test some of your reflexes here with my hammer. That's good. And back here, let me find this one. Okay. All right. And that's good. And your legs. There. And the Achilles. And you also have good plantar reflex down there. While I'm down there, I'm testing that to see that. And I'm going to have you go ahead and stand up for me.
Okay.
Just want to test your balance. Close your eyes. I don't see any swaying. You have good balance. gonna have you take a couple steps for me forward. Okay, that's good. And just to maintain your privacy, I'm not gonna have you bend over or anything like that, but when I was back there, I could feel your spine was straight. It didn't have any natural curvature of it, or anything like that. So, while you're just standing there, I'm just gonna have you close your eyes and you tell me if it feels, I'm gonna touch you and you tell me where I touched you at.
Okay.
And tell me if it was, soft or sharp.
Soft on my arm.
Okay.
Hard on my arm.
Okay, yeah, hard is good word.
Sharp on the cheek.
Okay.
Soft on the cheek.
Okay. All right, go ahead and close your eyes. I'm gonna put something in your hands. You just tell me what it is.
Okay.
Okay. And I'm gonna have you tell me what that is.
Paper clip.
All right, wonderful. And this, what's that?
It's a key.
Okay. Good. And I'm gonna draw a letter on your hand. You tell me what the letter is.
A.
Okay. And this over here.
D.
Okay, good. All right. Can you smile for me? Stick out your tongue and move it from side to side. And frown for me. Puff out your cheeks. I know it seems like a bunch of silly stuff. And I'm gonna have you push against my hands. Your shoulder strength is what I'm testing, and that's good. That's appropriate. Okay. So I think that you basically have a negative assessment. I could be missing a couple of things, but I think overall we, I assessed you from head to toe. Thank you.
You're welcome. Thank you.